In this video, you'll discover whether or not the ketogenic diet is healthy. Hi ladies and gentlemen, it's Dr. Zarowski and welcome back to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit that bell notification, join our notification community so I can help you excel your health and your life. In this video, we're talking about the ketogenic diet. Is the ketogenic diet healthy or not? This is a big question. Many people ask me when they come into the clinic, many of my patients, and then also a lot of people leave comments saying, well, my doctor said I shouldn't do the ketogenic diet because. And so anyway, let's go ahead and talk about some of the benefits it has to offer and then some of the common myths that many people come to me with saying the ketogenic diet is not healthy for. So anyway, health issues first. So metabolic syndrome is a big one. So if you have metabolic syndrome, basically the ketogenic diet is proven to be incredibly powerful. So if you have weight you're trying to lose, if you have high blood sugar, if you have insulin sensitivity issues, high blood pressure, anyway, when we look at metabolic syndrome, the ketogenic diet is very powerful at reversing this. The research shows it, but also there's so many personal stories of people going and stating that they had all these different symptoms of metabolic syndrome and they were even suffering for years from it, and then it went away when following the ketogenic diet. Now, in some cases of metabolic syndrome or even diabetes, for instance, if you are on a medication like on insulin, then you need to work with your doctor because following a high-carb diet while on insulin and then switching to a high-fat, low-carb diet, obviously there's going to be some big metabolic shifts in the body. So we always have to consider that and work with your doctor if doing so, but it's not a reason to not do the ketogenic diet. You just have to look at every situation and really understand what's going on with it. And if you're on a medication, then obviously you should work with your doctor on it. Next, neurological conditions. So the ketogenic diet benefits many neurological conditions. Now, when we look at problems like Parkinson's, Alzheimer's, ALS, epilepsy, many of these neurological conditions are just shown to be totally reversed, or even the symptoms go away when following the ketogenic diet, or the symptoms drastically improve. So neurological conditions typically do very well on the ketogenic diet. Now, last thing here is cancer. There's huge benefits to following the ketogenic diet while on cancer. So many people who have reported they follow the ketogenic diet while having cancer, and it helps starve out the cancer cells because the cancer feeds on sugar. And so basically, when we look at cancer and the ketogenic diet, they go very well together. Now, here's the thing here. There's a ton of other health conditions that the ketogenic diet benefits. And so, if you have a health condition and you want to know, just do some research on it. But certainly the ketogenic diet is very good for many different health conditions. Now, many people say, my doctor said it's bad. Now, I hear this all the time. Many of my patients who I recommend the ketogenic diet for, they go and say, my doctor said it's bad. Now, it's logically untenable as to why a doctor would just make a blanket statement saying the ketogenic diet is bad. Now, however, if you are someone who is suffering from a particular health condition and your doctor gives you good reasoning as to why it is not good to follow the ketogenic diet, then you should probably heed his advice. But if it's just a blanket statement without any detail, just saying it's bad and you shouldn't do it, then it's probably good to do a little bit of research and maybe even do a little bit of research on finding a new doctor. And so anyway, we have to really be careful with this because a lot of people are being told it's bad, and in fact there's so many benefits it has to offer. A lot of people say it's going to raise your cholesterol. Well, here's the thing that's interesting about that is that if you're just looking at your HDLs and LDLs and them going up when you're on the ketogenic diet, yeah, there's a good chance that it will raise your cholesterol levels a little bit. But here's the deal, is that when we look at cholesterol, it's an old way of actually understanding it to just look at the numbers themselves. What you really have to look at is the particle size in the cholesterol, the inflammation, the ratios from HDLs to LDLs, the CRP. So anyway, what we have to do is really look at the details of this. Just looking at cholesterol and saying, well, it went up, so it's automatically bad. I mean, there's so many other factors that we have to truly understand to be able to make a educated decision there. So anyway, when it comes to making an intellectual decision, you have to actually really get the proper data. Next thing here is a lot of people go and say it raises triglycerides. Now, first of all, that's false and it's a myth. When you're following a high-fat, low-carb diet, it's actually proven to decrease triglycerides. So that's not something that you need to worry about. A lot of people who don't really understand it just say, well, high fat equals increased triglycerides. But here's the deal. When you look at some people who are stating it does increase triglycerides, what they're really talking about is, consuming a high fat diet that's high in sugar and high in junk food and carbohydrates. And so what we have to understand is high fat, high carb is never going to be good. So basically, if you're, consuming a whole bunch of sugar, carbohydrates, and a whole bunch of fat and unhealthy foods, well then yes, of course it will, but we have to actually look at what the fat is associated with. Now, if you're associating eating a high fat diet with low carbohydrates, that's a whole different scenario. So anyway, that's actually research proven to decrease triglycerides. So anyway, once again, we have to really understand that the statement that it increases triglycerides is actually a myth. Now, the next thing that people say is you can't do the ketogenic diet because it dehydrates you and then it also flushes out electrolytes. So once again, this is, there's some truth to it, but what you have to understand is that when you're actually going through the phase of transforming your body metabolically from being a sugar burner to a fat burner, there are some shifts that take place. One of the things that does happen is you do flush out a lot of water and you do flush out a lot of electrolytes. But here's the deal, is once you're actually back into ketosis, or once you actually get into ketosis, what's going to happen is that these things are going to start to stabilize. Your electrolytes will start to stabilize and you won't be flushing water out as much. Now, typically on the ketogenic diet, yes, you do need to consume more water. Yes, you have to make sure that you're getting the proper electrolytes, but if you're following the ketogenic diet properly and you're eating a lot of leafy greens, you're going to get that potassium, magnesium, and sodium, and calcium in good amounts because leafy greens typically have good amounts in it. So anyway, when we look at water and electrolytes, once again, once you're in ketosis, it starts to balance out. And then, of course, once again, you just pay attention and add a little bit more electrolytes in, add a little bit more water in, but it certainly is no reason to state that the ketogenic diet is unhealthy and bad for you just for these reasons. So anyway, when we look at the ketogenic diet, it's a perfectly healthy diet to follow. When people are telling you that you just shouldn't follow it because it's bad for you, of course, that's false. There's good reasoning that you're being given as to like, hey, you have a particular condition that does not do well with the ketogenic diet, or you've researched it and you found that that's truth, then you need to make sure, of course, you are aware of that. In general, it's a great diet to follow. So be sure to give this video a thumbs up and share it with your friends so that they actually know the truth behind the ketogenic diet. They know that it's a good diet to follow. And then in the comment section, put any questions that you have. And then lastly, subscribe to my channel if you haven't done so yet. And then check out my other videos on how you can improve your health. I'll see you in the next video.